One of the most common questions that I get from people is, what causes a vagus nerve issue? And, I kind of jokingly say this answer, but I'm not joking, is that life causes that. Just being on this earth in modern day times is gonna kick your sympathetic nervous system, and the vagus is going to take a hit. Okay. So in my world, as soon as you walk into my office and you're asking me for help, I already know your vagus nerve is going to play a role in helping you get better. It just depends on how much of a role it's going to play. Sometimes it's a big one, sometimes it's a small one, but in relationship to the small, that can also be very, very big when it comes into physiology. Right? But you're going to have some physical causes to vagus nerve issues, and a lot of that is going to be how well that nerve physically moves and glides, and does it get adequate blood flow to it? Does it get waste removal from it, from the veins and from the lymphatics? And that can also be in relationship to chemical stressors that you get. That's going to be the chemicals that come from the outside world, type of toxins, but it can also be because you don't have a good waste management system in the body. You are stuck full of inflammation around the nerves and around the cells. And then that's what's called inflammatory interstitial stasis, a big fancy word that means fluids don't move around the cells, that they become stagnant, which is stasis. And then that causes some inflammation. That happens a lot around the vagus nerve. And of course, then you have the emotional part of what can take people out, because your emotions are going to change what? Your physiology. So that's the number one on my body ecosystem hierarchy, that whatever story you're going to be telling yourself will influence your fight or flight response or your parasympathetic response. And that can make a difference on blood flow, tightness and tension in the body. And then the cascade begins to flow. Okay. But I find that there's five big impacts to the vagus nerve. Now, one is dysautonomia. That means you have a nervous system that doesn't function well in balance, and many people are stuck in that chronic hypervigilant, hyperarousal, sympathetic dominant fight or flight, hang on to the edge of the cliff for dear life so you don't die. That's part of what it takes to survive in this world these days, and you get stuck there. Some people get stuck in the other end of it, that you'll see multiple times throughout the videos and through the webcast, of where you go into the dorsal vagal shutdown mode and you want to pull away from the world. Okay. So dysautonomia, upper cervical instability, which I'm going to show you here in a moment, is a big one. Though that you've got cervical vertebra, 7 bones in your cervical spine. And instability means that they're going to move too much. Okay. They've got too much mobility. And when that happens, you can put stress and tension and kinks or chokes into the vagus nerve. Gut inflammation is one in and of itself, leaky gut syndrome that people have. Then you have inflammation in the gut, and that's always going to coincide in my world with lymphatics that don't work well, because most of your lymphatic system lives in your gut. So the lymphatics and the vagus nerve have an intricate connection. Also, they'll have an intricate connection in the neck itself, because 1/3 of the 600 to 700 lymph nodes in your body, which are your mini toilets, reside in the neck. So if you get stagnation and congestion of the cervical lymph nodes in the neck, then that can cause inflammation around the vagus nerve, tightness and tension around the muscles of the neck, and then you get dysautonomia or vagal nerve issues. And then you have tension choke points. Right? There's a few big places that you're going to get this around the vagus nerve. There's 4 places that you're going to see coming on up, and we're going to review those in detail during the course. And another one are some viral loads or cytokines that also that are inflammatory proteins that travel up the vagus nerve. So here's a really cool one here by Michael Van Elzak, I think maybe it is that the herpes virus in particular, and most humans will have that herpes virus number 6. That it's been found to travel up the vagus nerve And a potent inducer of that are cytokines. And this is really important, everybody. When you get some of that interstitial inflammatory stasis, which is the fluid that doesn't move, that's going to kick off local inflammatory cytokine markers of interleukin 6, IL-6. And then that cascades everything, and it just starts to snowball out of control. That's another reason why when you begin to do some of the work around the neck, and we do some work down below in the abdomen, more for that dorsal vagal response, you can notice a system-wide change and improvement in the body. Okay. Now, the cervical instability is here. So I want you to take a look at this picture. It's a really cool picture. This is C1, C2. That's atlas and axis in the upper cervical part. This is your brain stem up top. And then your brain stem, you've got the midbrain, pons, and medulla. So this is the medulla because you're going to have the vagus nerve come off of the medulla. Remember, left side and right one. And then it's going to come out of the skull through that jugular foramen. And one of the first places you're going to have is a jugular ganglion of the vagus nerve. It's kind of like a big gathering point, cluster point of that nerve. And that's a big powerhouse for the motor output of the one that's going to be coming out of the vagus nerve. And then you're going to have the nodos ganglion that sits right around. This is where the largest lymph node in the neck sits, right here. And this is the part that takes a beating for the sensory input coming back into the brain. Because remember, the vagus nerve is 80% afferent, 80% sensory impact going into the brain. So if you have a lot of inflammation here, it can take that out. But you'll also have, if you have too much motion here in C1, C2, these move and they actually can twist and then tension and tighten and kink the vagus nerve right here. And then you get the vagal nerve dysautonomia. Okay. Many people can get, if you have too much motion in here, I've seen people get prolotherapy injections into that region, and that helps to lock down, if you will, and help stabilize the ligaments around that region. And here's another example here that you'll see, C1, C2. And this is what I want you to look at, everybody. These nerves are really close together. They intercommunicate with each other. So you got your facial nerve that sits there. Remember, the facial nerve is cranial nerve number 7 that's going to give you the control of what? Moving your facial muscles, right? You're smiling. And then you have your hypoglossal nerve right there. And that's the nerve to what? That's a motor nerve to the tongue to give you the ability to move the tongue in different directions. And right here behind the angle of the jaw, that's the largest lymph node that sits in the neck. And also coming down in there, if you remember, you're going to have your cranial nerve number 9, which is the glossopharyngeal nerve, and cranial nerve number 11, which is the spinal accessory nerve coming down there as well. So those can get impacted when you have too much motion in the upper cervical vertebra. Right? And look at this, is the vagus nerve superior cervical sympathetic ganglion. Right? So you also have a sympathetic nervous system up in the neck, and you have a superior cervical ganglion, you have an inferior cervical ganglion, and you have one in the middle. And that's really critical because they're going to be the relay station for what? Sympathetic input into the head, neck, and face. And you're going to see when we get to the thoracic part of the vagus nerve reset, the upper thoracic, particularly thoracic 1 and thoracic 2, it'll even go down to thoracic 4. They're the ones that are going to send the sympathetic nerve fiber signals up into these cervical ganglia, which then relay it up. Okay, that's going to be really, really critical for you to understand. So if I get this area here, I'm going to have a compromise in that nerve, but also the blood flow that goes here as well, because this is where you have the arteries going up into the brain. Okay. Particularly, you're going to have your common carotid, and then that's going to split off into your internal carotid and your external carotid. And then you're going to have the veins coming down there, the internal jugular vein and the external jugular vein that are going to go down into the main drain down at the collarbone, right? Now, this area takes a hit when people have text neck or poor posture, where their head tilts down a lot, it flexes down a lot, or you'll see in a moment it translates forward and they get a lot of excess tension. Look at my mouse moving here in the upper thoracic, the upper back. So here is where you have that thoracic 1 and thoracic 2. And look how much of a beating that is taking from here. And what I want you to understand is that's going to crush your sympathetic nervous system. And then that was the one that can actually cause you to stay in sympathetic dominant fight or flight in the head, neck, and face. And then that's another reason why you have vagal nerve issues, because you've got too much sympathetics going in, and the vagus nerve can't compete with that. Now, this is what many people have, is where the head slowly drifts forward over time. And remember, the vagus nerve is going to sit along the front of the neck. So you'll stretch it, you'll elongate it, you can kink it, you can choke it, but you'll also compromise your airway here, and you'll put down a lot of pressure where? In the back of the head. And what sits there? The brain stem. So you're already compromising blood flow to the brainstem, blood flow through the brainstem, because that's coming in from what they call the vertebral artery. And the vertebral artery is going to branch off down below at the subclavian artery, at the collarbone, right? Now, why does that matter? Because look at this difference in amount of stress with pounds coming down into that. What I'm going to tell you is this: if you stay in this position, you're always going to stay in a state where your nervous system is going to be compromised. You'll likely be staying in sympathetic dominance until you fall off the edge of the cliff, and then you go into that depressed type state. Now, when you have what's called a forward head carriage, that's this. You reduce vital capacity by 1/3. So what in the world is vital capacity? Vital capacity is the total volume of air that can be displaced from the lungs by maximal expiratory effort. So that means that you can take a deeper breath in, and you can have a better exhale out. Inhale in and exhale out. Now, that's really critical for the work that we want to do, because you'll see later when we talk about breathing. Breathing is a delicate balance between chemistry in the body, between oxygen and carbon dioxide. Breathing will change your autonomic nervous system. So inhaling will drive a sympathetic stimulation. Exhaling drives a parasympathetic stimulation. Longer exhales relax you. That's why they tell you to do slow your breathing down and make your exhales long. But you're going to make your exhales long as well, because you're going to be able to change the amount of oxygen and carbon dioxide ratios in the body, which is huge. The one thing that happens is that many people hyper breathe. They breathe too much. So they don't have a slow enough breath and a deep enough breath like this. So they expire too much carbon dioxide because they're over exhaling. And they're usually breathing too much from the shoulders and the neck and not enough from the diaphragm down below, which automatically does not stimulate the vagus nerve. So they're exhaling too much carbon dioxide. You'll do that when you're in a sympathetic dominant state. Now, why does that matter? Because we want to get more carbon dioxide to stay inside of the body, because increased levels of CO2 in the blood activates the vagus nerve and slows the heart rate. CO2 is a natural sedative. It soothes the irritability of the brain's conscious centers, promoting our ability to use logic, reason, and common sense. Why? Well, because that's the front part of the brain, right? The frontal part, the thinking brain. And this is the area that takes the biggest hit when you have poor blood flow in the brain, because blood flow always goes from back of the brain towards the front of the brain this way. That's the survival mechanism. The nervous system will prioritize the back of the brain as opposed to the front of the brain, because the back of the brain is your autonomics. That's your survival one. Thinking comes a distant second, because it's hard to think when you're dead and when you can't breathe and you can't chew and you can't hear. You follow? So this area takes precedence. And when you can have a better release of oxygen in the body, so the brain takes up about 25%, 20 to 25% of the available oxygen in the body. It takes up most of the energy in the body. So when something has a lot of energy, it needs a lot of oxygen. But what you'll learn is that it's not so much about the amount of oxygen that's in the blood, is can the oxygen leave the red blood cell to go into the interstitial fluid, to go into the cell. What offloads oxygen is carbon dioxide. Oxygen needs carbon dioxide to release so it can go to its target cell. That's the big takeaway. So if you have low amounts of carbon dioxide in the body, you do not have efficient delivery of oxygen to the cells, and that's going to put you into a state of fight or flight. Without CO2, we can become anxious, depressed, and angry. Take a look at around the world today. That's exactly what you see. CO2 directly influences the sensitivity of the vagus nerve's nuclei. What does that mean? That when you can get better body chemistry with CO2 oxygen levels, then your vagal nerve can work better. Why? Because now your vagus nerve nuclei, do you remember those? The nucleus ambiguous, right? Then the dorsal one we mentioned before with the polyvagal theory. If you haven't seen that video, what's coming on up, they now can have a response to the stimulation because they're going to be working better. That makes sense. That's a big reason why breathing helps you feel better, because of the intricate connection to the vagus nerve. That's a really big thing to understand. Now, the major choke points for the vagus nerve, I call them the vagal vulnerability points. You've got 4. One is where it's going to actually exit the skull. And I'll show you that during the course, the hole called the foramen that it comes out of. Number 2 is right where we showed you before for the cervical instability at cervical 1, cervical 2. And you're going to help those when you do the vagal lift. We're going to show you when you do vagal rounds, which is kinesiology tape around that region. The other choke point is as it's going down into the thorax to travel, wrapping around the esophagus, and that's going to be at the collarbone. They call it supraclavicular, above the collarbone, infraclavicular, below the collarbone. That's a major sticking point in that region because of fascial tightness and tension. The lung pump, the vagal rounds, and the vibration ball and massaging in that region and clearing your lymphatics will help that a lot. The 4th one is as it exits down through the diaphragm to go around the esophagus and drop down into where the stomach is. And that's called your gastroesophageal junction. So esophageal is esophagus, gastro is stomach. And we can get those with a manual scooping and a vibration ball that we're going to vibrate in that region. If you just pay attention to these 4 regions, I kid you not, you can make a huge difference in how you feel. And that's just 4 places. By the end of the whole Vagus Mojo, you're going to have a ton of things that you can choose from. Now let's get into how do you know you have a vagus nerve issue? Well, remember I told you before, that's super simple. You got one. I know you got a vagus nerve issue because you got one. But you can get almost any symptom under the sun that you could think of. Why? Because it's tied to your autonomics. And when your autonomics go, everything can start to fall apart. Some of the things that you can get. One, I'm just going to go through them piece by piece. Abdominal pain, anything in the abdomen, you name it. You can get chronic inflammation. Why? Because the vagus nerve is the #1 nerve to control inflammation in the body and your body's ability to respond to inflammation. Gastroparesis and bloating. That just means that you get bloating, puffy, swollen there, but you have either constipation, you have diarrhea, you have all sorts of issues going on down in the abdomen. Pyloric valve dysfunction. That's a valve that should open and close to allow food to pass and then not pass. And that's the opening from the stomach into the duodenum. And I'll show you where that is during the class. Small intestine dysmotility. That just means it's chaos in your small intestines. Large intestine dysmotility, chaos in there, constipation, diarrhea. Most often when you're stuck in fight or flight, you will be in constipation. Ileocecal valve incompetence. That's also another valve. It sits in the lower right corner of your abdomen, and that's the valve that opens and closes to allow things to travel from your small intestines into your large intestines so it can go out the poop chute. That area will take a hit and a half when you have sympathetic dominance. The sphincter of Oddi dysfunction is where you're going to get the bile salts and the pancreatic enzymes that are going to drop down into the digestive process coming from the gallbladder/liver. And that area, if it has an issue with that, you don't have enough bile salts coming on in. And that means you usually can't break down your food efficiently. And then you'll get all sorts of inflammation in your gut. Brain fog is a huge one. Brain fog is a big one because of the sympathetic dominance and choking off blood flow to the brain for a long period of time. Unusual heart rate, blood pressure, and you have heart rate variability is not that great, okay? So what we want to aim for with heart rate variability is around 70. I don't talk a ton about heart rate variability on, measuring it, because you can get all these heart rate variability measurements, and I just want you to try to aim for a 70, because I'm just trying to show you techniques that may impact your heart rate variability. Does that make sense? So, many people don't have good variability in it. And variability means this: you can respond to stressful situations and take yourself out of it. You can go down into a depressive state and take yourself out of it. You can go to both ends of the seesaw and the spectrum. That's when you have a high heart rate variability, because, man, I'm good. I can respond to my environment. Low means you may be stuck with a low number, right? You can be stuck with a high one. Nausea and vomiting, very common. Ear pain, because of the intracranial nerves that go into the ear, and the vagus nerve is intricately linked to the ear. So a lot of people will notice ear pain when they have vagal nerve dysfunction. Sympathetic dominance, sensitivity to light and sound. Hoarse voice is huge. A lot of people say, you know what, I can't talk for a long period of time because my voice gets hoarse. And that's going to be the vagus nerve and the glossopharyngeal nerve tied together. Number 9, number 10. Leaky gut that does not respond to gut treatment. You can't just go after the gut and not go after the brain, because the vagus nerve is a cranial nerve, and you can have a problem up top which affects the organ down below, and everybody chases the organ. Loss of the gag reflex. Constipation. Why? Because if you're stuck in fight or flight, pooping is not on your agenda, not dying is on your agenda. Low stomach acid, because the vagus nerve signals stomach acid release. If you have low vagal tone and you're stuck in sympathetic dominant fight or flight, stomach acid production goes down, because your brain says to itself, hey, man, we don't have time to eat anything right now. We got to not die, so there's no reason for stomach acid. And then what happens, it gets stuck there and you get low stomach acid production. That's not going to work out well for you, because if you have low stomach acid production, you are going to get chronic inflammation for sure, because of the inability to break down proteins, and you're going to have bloating, and you're going to have gut issues in your intestine and your small intestine. And I'll contend you're going to be a hot mess with low stomach acid. Uvula deviation or drop, that's a great one to do, which I'm going to show you here in a moment. And I want you to try to check this on yourself before the course. And I'll probably do a brief review of this one during the course. Chronic pain anywhere. Why? Parasympathetics puts you rest, recovery, healing mode. If you're stuck in fight or flight, you're always in breakdown mode. And ringing in the ears. Big part of that is because of issues with the blood flow. So there's a lot of stuff here, right? All over the map. That's what the wanderer is. But the vagus nerve is the pneumogastric. Pneumo means lung, gastric means gut. So breathing issues, gut issues, you always have to look at the vagus nerve. Now, let's look at uvula deviation. Now, the uvula is this freaky thing that hangs down at the back of your throat right here. And then, of course, you got your tongue, and you're going to have your oropharynx here. Pharynx is towards the back of that throat. And when you go to the doctor and they go, like that, they're trying to look for inflammation down in there. But what we're going to look for here is how the muscles up here in the back of that throat raise up. And does the uvula stay centered, or does it deviate and turn to a side? Because I want you to look up here. See these arches? So in these arches up here are muscles like this. And when you go, these muscles should contract, and they go up. If they go up in unison, which means you have good tone. I'm looking down your throat. So over here where you see the mouse circling, that's the patient's right side, and that's their left side. The right side is right vagus, left side is left vagus. Right side, right vagus, left side, left vagus. So you can have an issue with both sides, or you can have an issue just with one side. What we want to do is have good tone in these muscles here, so they can lift up the arch, and you know you have good vagal tone. Okay, look at this. To test the pharyngeal branch of the ventral vagus nerve. What the ventral vagus nerve is the which one? The green light, the myelinated one. And that levator veli palatini muscle, which is this one here, you see highlighted, that's because it's innervated by it, needs to raise up. Now, what you'll find is if they can both raise up and they look like they're contracting and the uvula stays centered, or you may very hardly see them lift up at all. And that means you can have low vagal tone on both sides because it's not lifting up enough. And the only way you're going to know that is to look down at enough mouths to tell the difference. What you'll more commonly see is where one side raises up and the other one doesn't, and then that pulls the uvula to a side, and you see what's called a deviation. Now, one thing that can happen here before I get into that, I want to show you this one. Because of that muscle here, remember when we went back to this one, the levator veli palatini? Okay, look at this. Levator veli palatini muscle. You see how it connects down in here? But look, it's going to influence the eustachian tube and the middle ear. Now, people who have vagal nerve dysfunctions can often get chronic ear infections, ear tube issues. Happens all the time, right? Because this muscle is supposed to pull on that tube to help what? Stuff drain down the tube. You got it? So when we do the I either go so it's like contraction reps in there that happen. You want to look for a deviation. So remember, this is looking down the throat. What I want you to note here is that this right side, the patient's right, your left, is contracting up. So you see how this arch is higher on this side, lower on this one, and look, the uvula is going to deviate with it. The high side is the side where the vagus nerve works. The high side is the side of the vagus nerve that works. Why? Because it's contracting and it's lifting up. The low side, which is this person's left side, is the dysfunctional side of the vagus nerve. So this is a left vagus nerve dysfunction. Right side looks okay, left side, not so much. So what we may find is more issues on the left vagus along its pathway, along its choke points. When we stimulate it, we want to look for it changing this arch. What you may very often notice, and it can happen rather quickly, is that when you do some stimulation to the vagus nerve, particularly on the left, and you go back and you do the it now raises up and they're more even. Sometimes it takes longer because this is a muscle that if you don't use it, you lose it. Kind of like muscles that you don't go to the gym for a while, they can have some weakness to it. It might take you some time to develop it up over time for it to come back. So the uvula will deviate towards the functional side and away from the dysfunctional side. So in this case, it's a left vagus nerve dysfunction. Now I'm going to show you a few pictures just taken off the internet of what these look like. So if I look down a person's throat, this is the what? Left. That's their left vagus. That's their right vagus. You see how high this one is. This one is low. The left side is the functional side. The right side is the dysfunctional side called dystonia, low tone. This is the normal one. I want you to look at the arches here. You see the arch and you see this arch. Okay. They're relatively close together, right? And then now we're going to look at a left vagus dystonia. So down below, we saw a right. We go, See how high this right one is? And it pulls the uvula that way. You can see it hooking there. And then this is the low side. You can see it here for sure, right? And this is left vagus nerve dystonia. So I always do an on every single one of my clients to let me see what's going on in relationship to the uvula. And many people don't even know they have this issue going on. Now, if it's a dystonia in both sides, what you'll likely see when they do is you won't see much action in these muscles here at all. You really won't see that musculature at the back of the throat rise up. And again, that's just going to take repetition, repetition, repetition. What I'd like for you to do is to, look in a mirror or use your phone and put it on record and look down your throat with the light on if you can and go, or have somebody look down there and record a video. And you want you to see, can you notice a difference for yourself? And does it clinically make sense in relationship to, some of the symptoms of stuff that you might be feeling for your vagus nerve issues? Because you have a right vagus and you have a left vagus, and you have a right sympathetic and a left sympathetic. So you can actually have an issue with just one side of the vagus as opposed to the other. You can also have one side of the body that's more sympathetic dominant than the other. And that's a lot of reasons why people will say, I feel most everything on the left side of my body, or I feel most everything on the right side of the body. You automatically better be thinking up in the brain when there's more of a left side and a right side issue, because when the body compensates and adapts, when it's normal and resilient, it zigzags compensations. So it'll go across the body and back and forth to try to stabilize itself. When you have a dysautonomia, then it can lock down on one side. Then one side can be a hot mess, and the other side is okay. I immediately want you to start thinking of the vagus nerve, the cranial nerves, and the sympathetic nervous system being imbalanced from one side compared to the other. Okay, so that's a good summary for you on what causes some of the common causes of vagus nerve issues. Okay, how do you know you have a vagus nerve issue as well? So now you're going to mix that in with looking at the polyvagal theory video, as well as watching over and over and over the basics and fundamentals of the vagus nerve, understanding some of the neurology and physiology behind it. Hey, good job, everybody.